Okay, first thing I would do is I would knock on the door. I would close the door for privacy, perform hand hygiene. Okay, hello, my name is Angie. I'm going to be your student nurse today. Can you tell me your name and date of birth?
Sophia Sauer, 11/23/2004.
Okay, can I see your wristband? Okay, thank you. Okay, Sophia, do you know where you are today?
The hospital.
Do you know why you're here?
For head to toe assessment.
What year is it?
2025.
Okay, so patient is orientated to time, place, and person. From what I can see, patient's appearance is well-groomed and relaxed. Patient's speech is understandable. Patient's body build is of tall stature. Patient's mood is pleasant. Okay, have you had any past skin diseases?
No.
Any pruritus, environmental or occupational hazards?
No.
No? Okay. So now I'm going to check for my patient's temperature. Patient's temperature is warm. Patient's moisture seems normal and the texture is smooth. Now I'm going to check for skin turgor. Okay, patient's skin turgor is hydrated. Okay, now I'm going to ask you a few questions about your heart. Do you have any chest pain?
No.
Do you have a cough?
No.
How many pillows do you sleep with at night?
1.
Okay. Do you have any history of heart diseases?
No.
Okay. So now I am going to auscultate the apical heart rate with the bell. Okay. For 30 seconds. Okay, is it okay? You can sit up. Okay, so I did that for 30 seconds. The heart rate was 60 beats per minute. But before that, also, I would inspect for JVD. So at 30 degrees and then 90 degrees. So can you tilt your head to the left? Okay, now to the right. Okay, and now I'm going to palpate her carotid pulses as well. Can you to the left? Okay, now to the right. And I would do this at 90 degrees as well. So after doing that, now I'm going to auscultate and I'm going to check my patient's heart with the diaphragm and then the bell. Okay, so with my diaphragm, so this is the aortic, pulmonic, tricuspid, Erb's point, mitral. Now with the bell, I do the same thing, aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, after doing that, now I'm going to ask you a few questions. Have you had any past lung diseases?
No.
Do you have a cough?
No.
Shortness of breath?
No.
Okay, so now I'm going to inspect my patient's upper anterior chest for symmetry. So from what I can see, my patient's shoulders are symmetrical. I see no bulging or retractions in our intercostal spaces. Patient's skin color is consistent with genetic background. Patient has a 2-to-1 ratio. Okay, now I'm going to palpate. I'm going to check for crepitus and tenderness. So I'm just gonna. Do you feel any tenderness?
No.
Okay. So now I'm going to do tactile firmitis. I'm going to ask you to say 99 while I do this motion. Okay. So
99, 99, 99, 99.
Okay, so tactile firmitis is equal bilaterally. Now I am going to percuss. Okay, and now I'm going to auscultate as well with the diaphragm. Okay, can you take a deep breath for me? Deep breath. Another deep breath. Deep breath. Another deep breath. Deep breath. Okay, so after doing that, patient's breath sounds are bilaterally. Now I'm going to inspect my patient's posterior, so I'm going to ask them to sit down. Okay, so upon inspecting my patient's posterior, I see that their shoulders are symmetrical. I see no bulging or retractions in her intercostal spaces. Patient has patient's skin color is consistent with genetic background. Now I'm going to check for chest expansion. So can you take a deep breath for me? Okay, patient's chest expansion is symmetrical. Patient's breathing is automatic and effortless. Now I'm going to percuss to check for resonance. Okay. And now I'm going to auscultate as well with the diaphragm. You take a deep breath for me. Another deep breath. Deep breath. Another deep breath. A deep breath. One more. Okay, patient's breath sounds are clear and bilaterally. I also, while doing that, I was measuring her respiratory rate for 30 seconds and it was 60 beats per minute. Okay, thank you. So now I'm going to ask you to sit back on the chair. Okay, so do you have any leg pain or cramps?
No.
Do you have any sores in your arms and legs? No. Any swelling in your legs?
No.
No, okay. So now I'm going to check her pulses. I'm going to check, can you spread your arm, put your arms like that? I'm going to check for radial, ulnar, brachial, popliteal, this one too, yeah. And then femoral. Femoral, I would only look at it. It's in the inner third groin crease. Now I do the posterior tibialis. Can you take your shoes off for me? Thank you. Okay. That's the posterior tibialis. Now the dorsalis pedis. Okay, now I would check my patient's radial pulse and count for the respiratory rate for 30 seconds. And it's 60 beats per minute. Okay, now I would check for capillary refill. I see your finger. Okay, and I would do this on her toe as well. Okay, and now I would check for any swelling in her legs. Okay, thank you. And down here. Then I would do the same on the other leg. Okay, there is no edema noted. So now I'm gonna ask you a few questions about your abdomen. When was your last bowel movement?
This morning.
Do you have any abdominal pain right now?
No.
Any history of abdominal pain or
No.
anything? Okay. Do you have a cough?
No.
Okay. Can you lay down for me, please? At 0 degrees. Okay, can you put your shirt up for me, please? Okay, so I'm inspecting my patient, and patient's has no lesions from what I can see. Patient's contour is flat. Patient's skin color is consistent with genetic background. So now I'm going to auscultate. That's the first step in the abdomen. With the diaphragm, I'm going to start in the right lower quadrant. Now I'm gonna check for bruit, so I would do the bell side, and I would do this 1 to 2 inches above the umbilicus. So there is no bruit noted, which is good. Now I'm going to percuss I'm going to be doing this in a zigzag pattern. Now I'm going to palpate. I'm going to palpate superficially and then deep. So superficially is with one hand. Now deep with two hands. Okay, and now you can sit up. Now I'm going to test for CVA tenderness. Okay, so now I'm going to check for CVA tenderness in her posterior. Okay, so there is no CVA tenderness, which is good, and that is it. I would give my patient her call light and give her anything else she needs, and I would close the door for privacy, and that is it.